Title: How a Government Shutdown Affects Healthcare. Introduction. Good afternoon, everyone, and thank you for being here. Today, I want to talk about something that doesn't always make the front page until it hits home: a government shutdown, and what it really means for healthcare in America. When we hear shutdown, we usually think about closed national parks or unpaid federal workers. But behind the scenes, a shutdown can affect the care we receive, the insurance we depend on, and even the hospitals that keep our communities healthy. Let's take a look at 5 key ways a government shutdown impacts healthcare. Key point 1: insurance coverage and rising premiums. First, a shutdown threatens the financial help that millions of Americans rely on to pay for health insurance. These are the subsidies that lower premiums under the Affordable Care Act. If Congress doesn't renew or fund those subsidies, families could see their premiums double next year. Even before that happens, the uncertainty alone causes problems. Insurance companies plan ahead. When they see political gridlock, they often raise rates to protect themselves. That means many people may decide to drop their coverage altogether, increasing the number of uninsured Americans. In short, a shutdown adds stress not just to the government, but to the wallets of regular people trying to stay covered. Key point 2: pressure on community health centers. Second, the shutdown puts tremendous pressure on community health centers, the clinics that provide care to low-income or uninsured patients. These centers rely on federal grants to operate. Without funding, they may have to reduce their hours, furlough staff, or even close some sites. When that happens, where do people go? Often straight to the emergency room. That drives up costs for hospitals, creates longer wait times, and reduces access to routine preventive care. So the shutdown doesn't just affect federal employees, it directly affects people who already have limited access to care. Key point 3: delays in provider payments and hospital programs. Third, let's talk about hospitals and doctors. While Medicare payments continue legally, there are still delays in reimbursements, contract approvals, and audits. Smaller hospitals, especially in rural areas, depend on those payments to keep the lights on. Some important programs, like the Medicare Hospital at Home initiative, which helps patients recover safely at home instead of in the hospital, are being paused due to funding uncertainty. Even a few weeks of delay can create serious cash flow problems for healthcare providers. Key point 4: reduced oversight and slower agency operations. Fourth, when the government shuts down, so do many of its oversight and regulatory functions. Agencies like the Centers for Medicare and Medicaid Services and the Food and Drug Administration send thousands of employees home. This means fewer safety inspections, slower drug approvals, and delays in rolling out new healthcare policies. For patients, that could mean slower access to life-saving treatments or a temporary halt in certain clinical trials. Oversight may sound like bureaucracy, but it's also what keeps our healthcare system safe and reliable. Key point 5: long-term public health risks. Finally, a prolonged shutdown can weaken our overall public health. Programs that track diseases, respond to outbreaks, or fund community vaccination drives may lose funding or pause their work. Claims processing slows down, and even telehealth services may be delayed. If the shutdown continues, we could see more uninsured people, more overburdened hospitals, and more preventable illnesses in the months ahead.